Ladies and gentlemen, I'm Dan Montano. I'm the Chief Executive Officer of Życie Genesis Medicine. Życie is the Ukrainian word for life. My wife is Ukrainian. When we said, what's a good name for the company, she proposed Życie. For those of you that are married, you know just say yes to start with and minimize the pain, then try to argue with them. I'm going to be talking about investing in biotech, important concepts to succeed. So, first of all, I'm now 71. I have a bachelor's degree in business and accounting. I have an MBA from the University of Southern California. I was 7 years a professor in finance, economics, and investing. I started the investment business in August of 1968 on the floor of the Los Angeles Stock Exchange, and for 30 years I was an investment banker. As an investment banker, I took over 100 companies public under my own flag, meaning I ran the show. I started about 100 companies, and I turned around a lot. I was with investment firms such as Wedbush, Haydenstone, Shearson, and Lehman Brothers. I should probably take that one out, shouldn't I? And I've handled, I'd said, over 100 IPOs. Now, I have participated in 100 startups. I've managed the international investment banking operations out of London in the 1980s, and I have extensive international and financial relationships around the world, which I'll bore you with later. And I've made numerous presentations all over the world. In the last, since the financial crisis, I lost $200 million. So people have come to me and said, Dan, if you're going to talk to people about investing, why do you start off by telling them you lost $200 million in the financial crisis? I said, well, the good news is, you can't lose it till you make it. So at least you know for a while I was good. Now, young biotech companies are high risk, high reward. They are not further risk averse. If you are averse to risk, if you can't sleep at night because something's at risk, you do not want to be in biotech. Because even if you're right about biotech, the ride can make you sick. Being able to see the future using common sense is one secret to succeeding in all investments. Now, I want to come back and emphasize something. Looking into the future using common sense. I have the ability to predict 100% of the time the future when I use common sense. And this is one of the things I'm very fanatical about. Simple, fundamental truths. So 100% of the time I have been able to predict summer will follow spring, fall will follow summer. Never been wrong. I'm able to predict that March will follow February. 100%, never been wrong. Now the reason I make this comment is because investing, especially in high risk things, the most important commodity that you have to use is common sense. My father was a scientist. He was a brilliant man. He used to say any idiot can make something complex. But if it's not simple, it's not true. And so in this case, we're going to talk about common sense and looking into the future, because if it's not simple, if it's not obvious, it's not going to be real. Now, one last story. You know, I'm the kind of person that walks through the the deserts of California. I look up on the mountains. I see them packed with snow. I see this dry gully. And I predict when the snow melts, the gully will have water. So when we talk about looking in the future with biotech, we're talking about if you don't see the obvious, don't do it. Lastly, experience is the best teacher. As I told you, I've lost $200 million since the financial crisis. I lost so much money, I almost became a Democrat. Thank you, I appreciate that. These jokes don't go over well in California at all. But I also want to emphasize something is worth what you pay for it, people, and recognize that what you paid for this presentation is nothing. So that's the only value you should put on it. If you learn something today, bless you. But don't go home and say, oh, listen, this guy's a genius, I'm going to do this, I'm going to sell the house and go do this. People, common sense, it's worth what you pay for it. So biotech investing, concept number one, the most important concept of all, cash. Cash. The only reason you ever invest is for cash. You don't invest for happiness. You don't invest for good luck. You don't invest because it makes you feel good or because your uncle told you to. You invest for cash. You take cash to get more cash back. And that means if you don't know how you're going to get your cash back, don't do it. You know, I used to have people that would tell me all the time, why was I always bragging about cash? Cash is the medium of exchange. It is the standard and measure of value. You invest your cash and you want to get more cash back. And if you have any other rationale for what you're doing, you're wrong. Biotech investing. Unmet medical needs. This is an important concept, and we're dealing with concepts today. By important concept, there are basically, according to the FDA, two categories of medications. Those that service a well-serviced medical need and an unmet medical need. So let's talk about the well-serviced one. Antacids. According to the FDA, there are 286 prescription antacids. If you decide you're going to develop another antacid, the FDA goes, right. Why is yours better? Why is it safer? Why we have 286 and you go to the drugstore and solve most of them. Unmet medical need means there is no acceptable medical treatment. Example, cure for cancer. Example, cure for Parkinson's. Example, cure for Alzheimer's. These are unmet medical needs. So what does that mean? That means the patients want you to succeed. That means the doctors want you to succeed. That means the payers want you to succeed. And that means the government wants you to succeed. And you need all four of those if you're going to succeed. So when somebody comes and says, oh, we have a biotech company and we're going to work on RNA synapse managers, there's no disease there, people. There's no disease. It is a biotech study program. If somebody comes and says, oh, we're going to do this and that, it's got to be, if you can identify the medical need and you have an unmet medical need, the path to victory is easier. Disease-modifying agent, concept number 3. Every disease, every pharmaceutical either modifies the symptoms or modifies the disease. Example, if I get a cold, my nose is blooded, I go to the store, I buy an antihistamine, it helps dry up my nose. It does not cure my cold. It simply deals with the symptoms. Now, question. 100 years ago, 1918, what was the average life expectancy of a male in the United States? No, you have to wait out. You're going third. Anybody else? First. Anybody? 40, 45. Anybody else? 74? Bless you, child. I love that book, Shangri-La. Your turn. 35. 35 years old was the average life expectancy. And if that's the case, I think you're the only one to be alive in this room today. Okay? Oh, I'm sorry. And you ladies, of course, because you're just 21. Okay? 35. So why did life expectancy in the United States double? One reason. Antimicrobials, penicillin, etc. Things that took on the primary cause of death, which were bacterial infections, tuberculosis, cholera, diphtheria, syphilis. All of these were terminal diseases, and those terminal diseases can now be treated, and at best they're an inconvenience. So disease-modifying agent means, does the drug you're working on modify the disease, or does it just address the symptoms? Now, there's a company in San Diego called Acadia Pharmaceutical. They have developed a very big tranquilizer, like Prozac, but on steroids. to deal with the symptoms of hallucinations in late-stage Parkinson's patients. You've probably seen their commercials. It's the guy kind of wandering and he sees a dog and the dog goes away. They got a huge budget, $25 million a month, and they can't get any attention. It deals with the symptoms of Parkinson's, not with the disease itself. Concept 4, FDA breakthrough designation. So everybody in this room knows that everybody complains about the FDA takes too long, and I would be at the front of that line. So the FDA has come up with something called a breakthrough designation. This is when the FDA says, wait a minute, this drug is not another antacid. This drug is addressing an unmet medical need of material importance. So therefore, we're going to designate it, designation, a breakthrough therapy, meaning that you can get accelerated treatment with the FDA, you can get accelerated review, you can be approved after phase 2, all kinds of wonderful things. But from a stock market perspective, companies that get this designation, their stock market value goes up between $200 million and $2 billion over a period of about 30 to 60 days. Now, I don't know about you people, but if I could make an extra couple billion in 60 days, it would make me happier. Okay? Breakthrough designation. Let me give 2 examples. This is the company in San Diego I mentioned, Acadia Pharmaceuticals. They have one approved drug, Neuroplasty, treats hallucinations in late-stage Parkinson's. It's basically an antidepressant. The drug received breakthrough designation from the FDA, and the value afterwards was $3.8 billion. Now, this is before any drug was approved. This was all in anticipation because they had breakthrough designation and they were working on an unmet medical need, which is a symptom. $3.8 billion. No sales, no revenues, no product. Once again, if I have no abilities, no talent, no way to earn money, and somebody gives me $3.8 billion, I think that's a good deal. This is Intercept Pharmaceutical. Went public October 2012 at $19 a share. January 2015, Intercept had no FDA-approved drugs. The shares opened the morning of Friday, January 30th at $167. The same day they announced they had a breakthrough designation. That afternoon it closed at $201, or up 17% for the day, increasing the value $660 million for one day. Breakthrough designation. Now, this will make a lot more sense to you when we get to objectives, okay? But breakthrough designation is something you want to look at. Once again, if a company comes and says, oh, we're working on an RNA messenger interrupter, so what? It's not a disease-modifying agent, it's not a medication, it's a biological concept, it's a theory that maybe in 15 years will be something, but you cannot get a breakthrough designation on something like that. Only chase big opportunities. Okay, this is important. Everybody makes mistakes. In front of you is a guy who has lost money. I had a venture fund in the late mid-80s. 1987, I lost $37 million. Now, overall, we made $150 million for that year because our winnings outnumbered our losses. But you take losses. Now, I don't care how smart you are. If you and I decide to go into business and we're going to chase a small opportunity, we're going to set up a dry cleaning shop here in Philadelphia at the corner of 4th and 4th, and there's 4 competitors around us. Well, let me tell you, we're going to work hard, we're going to work difficult, and we're going to be lucky to be able to buy a Hyundai after 15 years. Because anything can break us. Change in the tax law, change in the weather, change in the depression. We have a small opportunity and it is fragile. I learned from being an investment banker, only chase big opportunities. So that no matter how stupid I am, no matter how unlucky I am, no matter how much I foul up, the opportunity is so big, it still carries me to the finish line. Instead of you and I opening up that dry cleaning shop, we get the rights to a potential oil field in Canada for 1 billion barrels of oil. Billion times 57 bucks, $57 billion. You can make a lot of mistakes. Yes, sir. Okay, but let me come back to my point. My point is the opportunity has to be massive. So if you look at the opportunity, I mean, if you would have asked me 20 years ago if I would have invested in Facebook or Google, I would have told you no way, okay? There's no way I'm gonna do anything that stupid, okay? I've got friends up in Silicon Valley who invested in those things, and I told them what idiots they were. You know, there's no future in, digital nothing, okay? It is the size of the opportunity. When I got involved in our company, Jicha, we have a treatment I believe that will revolutionize the care of heart disease. I believe that our molecule injected into the heart will treat heart disease. Now, 80% of the people that die of heart disease in this country do not die from the large vessels being blocked. They die because the small capillaries become blocked. Small vessels disease. Women, that's what kills more women than anything else, okay? It kills Asians, it kills Orientals, it kills Latin Americans because they have smaller vessels, okay? So when I looked at the situation, what is the opportunity? How many people could I treat in the United States if this drug gets approved? 1 million, 3 million? $30,000 each, it's 30 billion to 90 billion. Now, believe me, when I started, I didn't have a postcard. But the point is, I got 30 billion, okay? How many people in this room have Parkinson's disease? Nobody. Okay, I don't believe it, but nobody. We have investors from Kuwait, Saudi Arabia, Algeria, Tokyo, have Parkinson's disease. They're billionaires. And they don't like their Parkinson's disease. They want us to succeed. It's a huge opportunity. So in each case, what I'm trying to say is the dream's got to be big enough. First you have to have a dream, then that makes a plan, that makes a thing, and you build it all the way through. But if your dream is not big enough to hide your mistakes, you'll have to live with your mistakes. Okay, let's try it a little different. Yes, honey. In very tiny markets. Yeah. Yeah. So let me give a little different example. I'm going to go out this afternoon. We're all starving. Nobody in this room's eaten for a week. And I'm going to go out this afternoon and I want to hunt for a mouse. I'm going to hunt for a mouse, and if I catch the mouse, I got one bite of food. How many want to come with me hunting? No food for you. Wait a minute, I got a mammoth. I got this big mammoth. It's slow. And if we get this mammoth, we got food for a month. Who's coming with me? That's the difference. You gotta have a big prey, because that's how you get support. And whether that support is people's passions or it's money, you can't build a company without that. So only chase big opportunities. Market number 6, marketplace exclusivity. And this is actually something that it's amazing how many people don't know. A patent in the United States lasts between 18 and 20 years. According to Tufts University, it takes 26 years to get a drug approved. That means that almost no drug can be approved that has a patent. Life's simple. So the United States and Europe decided that this was thwarting development of drugs that would treat people. So the United States and Europe created what they call marketplace exclusivity. The first company to come to market with a medical indication gets a monopoly. If it's a biological drug, it's 12 in the US, and in Europe it's 10 years. If it's a chemical drug, it's 5 years. People here know Celgene. They're in New Jersey. Celgene got started with one drug, thalidomide. Those of you who are old enough to remember the flipper babies of the 50s and 60s, thalidomide. The patent ran out before any of you graduated from high school. The drug has been basically socially banned forever. Celgene took it and said, we're going to use it on late-stage cancer patients to inhibit the vascularization of tumor growth. They made $1 billion in sales the first year in Europe and in the United States. That is how Celgene got started. Marketplace exclusivity. This means you can have a monopoly. Now, I have had people come up to me and say, oh, Dan, if your drug gets approved for the heart or gets approved, you're going to have competition in 10 or 12 years. I can live with it in 10 or 12 years. I'm 71. You make hay when the sun is shining. But the reality is this gives you a competitive edge. Value, new technologies, cost, standard of care. Now, this is important because it doesn't exist in the medical development pharmaceutical business. As I told you, I started in California as an investment banker in 1968. 1969, somebody came into our securities firm and wanted to finance a new computer company, a thing called a mini computer. He talked to my people, the owner of the firm, Chet Noble. Chet Noble, we called him Old Man Noble. I didn't know he was only 52. And he says, oh, we should help this company. Computers are the future. Who can help this guy? Who knows anything about computers? And in the whole firm, everybody slinked down in their chairs because this is 1968. I'm 20 years old. I'm going to college right now. I'm taking Computer 101. What more, listen, you never get smarter than after you're 20. Okay, after 20, it's all downhill, right? So I raised my hand. For the next 6 months, I was a gopher. I ran around picking up bags, running things. I didn't know anything about computers. I didn't learn anything about computers. We raised $1.5 million at $1 a share. 9 months later, we took the company public at $6 a share. 2 years later, that company sold out to McDonnell Aircraft in St. Louis for $254 a share. Now, let me help you people understand. I was smart. Because when people see that you invest in something and it goes up, they assume you're smart. So I learned from the computer business an interesting concept, and that is that you cannot introduce a new computer unless you have what is called a price performance advantage, a 30% price performance advantage. Okay? So this is the cost of standard of care. This is a new treatment. How many of you people in this room have a cell phone? Anybody? Okay, very good. This is my Apple phone. If I decide to go into competition with Apple, and my smartphone is going to weigh 75 pounds, have a 30-minute battery life, and it's $47,000, who thinks I'm going to succeed against Apple? I was really counting on one person raising their hand. So the reason I say this is the cost of medical care does not bear reality to the cost of creating the service. In this case, you have situations where Pfizer just announced a drug that's available for $2.1 million. Now, personally, I can't afford that. You have drugs like the one that came out from Arcadia. It's $30,000 a year to deal with the hallucinations. If you read the insert, the placebo had the same benefit to the patients as the drug. The adverse events were the drug killed twice as many people. And yet it's $3,000 a month for no benefit. In our case, we have set as a corporate policy that we will not develop anything that we cannot come in at 20% of cost of standard of care. So if it costs $4,000 to treat a diabetic foot ulcer, we have to come in at $800, 20% of that. If you go to United Healthcare and you ask them, what do you set aside when you authorize a 3-vessel angioplasty with stents, they have to budget that money. And they will tell you it's $285,000 today. We have to come in at 25% of that, or 20% of that. And that is because I believe in the next principle. Oh, this is biotech, next one. Understanding timing. Biotech is not from here to here. You don't invest because you plan on seeing the end of the game. You invest because along the way you can take steps and you can make money along the way. If you start here and the company proves proof of concept here, the value goes up materially. If from proof of concept you get phase 2 data and you get FDA breakthrough designation, the value goes up and you keep heading down this pathway. You don't want to get into a biotech stock unless you understand all of the points where it gets refueled. You want to know all of the places. If you get in here and you're planning on waiting to there, you're an idiot. You have to look at every measure along the way and say, when do I take some chips off the table? Now, I took a company public once, Energy Conversion Devices, went public at $10 a share, went up to almost $800 a share. And people were all over me. Oh, Dan, you sold out early. Yeah, I started selling some at 20, some at 40, some at 80, some at 100, and I was out of everything at 200. Well, you want to know something? No one has ever gone broke by taking a profit. So biotech is not something that you're involved in because you have this glorious end. I want to be at the end. I want to take these shares to my grave with me. You have to know how to get out before you get in. Next one, seeing the future, common sense. Nobody likes this one. Nobody likes this one. Everybody's going to dislike me. I did my graduate thesis on insurance. Insurance is when you calculate the risk of an event, you develop a premium for it, you collect the money, you administrate it, and you pay it out. Today, what we call health insurance is not health insurance. You cannot charge $500 a month to pay out $2,000 a month. The healthcare system in the United States is bankrupt. At the federal level, the state level, the city level, the county level, the unions, they're bankrupt. There's no issue. Europe is worse. And by the way, my wife comes from Ukraine. She was raised under communism. I went to the communist world to help them convert. I have seen single payer. And you don't want it. Okay. The reason I'm saying this to you is I believe within the next 5 to 7 years, the healthcare system as you know it will not exist. That people will be paying effectively out of their pocket for their healthcare services. Now, for those people who went to the Soviet Union or those people who have been to France, those people who have been in places where they have socialized medicine, they'll all tell you the same thing. If you get in line at the public hospital, you are not going to get well. If you can top it off with some cash, it makes a difference. In England, when I was looking at the bypass situation, in England, they will not put you on the list to get a bypass until a doctor has evaluated you have less than 2 years to live. Then you go on the list. Unfortunately, the list is 3 years long. Okay. No, it gets better. Because if you live the 2 years, obviously you were just misdiagnosed and you get off the list. Okay. The reason I'm saying this is, people, you have to use your common sense. If you're going to invest in a company and they have to sell something for $2 million, ain't going to happen. We have to look at the reality that healthcare costs are going to be borne by the people. Now, by the way, one other comment, because a lot of people, I'm a fanatic free marketeer, okay? Milton Friedman, I was very close to. Art Laffer was on the board of one of my companies. Steve Moore has been one of my shareholders. I'm a fanatic free market entrepreneur. I've gone and taught economics and free market. I'm a fanatic about it, okay? People say, well, when you went to the communist world, what was it like with no competition, no markets? Bull. They had one of the most vibrant free market systems you've ever seen in your life. It was called the black market. You didn't get shoes, you didn't get food, you didn't get education, you didn't get anything unless you paid for it. The reason I'm saying that is you will look in the future and you will see that the healthcare system, the way it is now, is unsustainable. And therefore, if you're going to invest in something, use common sense and come to the reality, will they be there? Last one, concept number 10. Believe in what you're doing. The one thing great about biotechnology is it can make you feel good. It can make you feel as what you're doing has a purpose. Now, I think some of you have seen the ABC News clip, right? That Dr. Jacobs and them showed about our heart drug. Okay, you'll see it later on. ABC Nightly News did a 2-minute splurge on our drug growing blood vessels in the human heart. For those of you who've just met me, let me help you with something. I'm a control freak, I'm hands-on, and I'm really a pushy SOB, okay? I was at the University of Cincinnati when the first person was interviewed. Her name was Constance Donnelly. You can see her on the ABC News clip. She was given less than 1 year to live. She volunteered not because she liked me. She volunteered because she was told she'd be dead within 12 months. She signed up, the press, the doctors are there, the press is there, everybody's there. After they all leave and the lights go off, they put her in a wheelchair. She's what they call a cardiac cripple. She couldn't walk from here to the escalator. And as she's reeling by, she's 54 years old. She's reeling by, she knows who I am. She grabs my hand. She says, Mr. Montano, I hope this works, or my 5 children won't have a mother this Christmas. Now, when I tell you I'm a hard-ass businessman, it's true. But I've never had a mother beg me for her life. And I would never do that again. Plus, I knew something that no one else knew. The FDA had required the first people dose get 1/10 of what we thought worked. I knew she was being sacrificed for statistical analysis. Well, if you see the ABC clip, people, that is her heart, the before and after. She had the most robust response we've ever seen in our lives. We know that we help change her outcome. We believe that we can save 1,000 lives a day if our heart drug's approved. In the case of diabetic foot ulcers, we have one gentleman who invested $20 million with us on one condition. His father had died of a diabetic foot ulcer. He wanted us to name it after his father. Hey, that's what he wanted. We have people have Parkinson's disease in Germany, Kuwait, everywhere. They want us to succeed. And we've got to know these people, and we care. And if you believe in what you're doing, it makes the journey better. Now, please understand, you still have to want to turn cash into more cash. But if you believe in what you're doing, it definitely makes it easier. So keep these concepts in mind. Cash matters, drugs that treat unmet medical needs, disease-modifying agent, breakthrough therapies. Chase only the big opportunities. We're going after mammoths here, people. We're not going after mice. Marketplace exclusivity, value of new treatment, timing and milestones, see the future, and believe in what you're doing. Now, we have an exhibition booth here, right, Vika? 300? And by the way, at that booth, Jack will be giving intermediate presentations on Parkinson's and whatever. There's a list of them. I want to thank you all for coming. How am I doing? I'm doing great for me. So are there any questions? Yes, sir. How would I avoid the big loss? I wouldn't have. You have to understand something. One of my shortcomings is I'm a true believer. True believers don't quit. So when the financial crisis came along, I mortgaged our home. I put $1 million in. I sold out my 401k. I put everything in. I put in $20 million. I guaranteed $20 million. I'm a true believer. You know, the reality is, and I say this, doctor, to people, I made a lot of money as an investment banker. And by the way, I was recently somewhere and somebody was saying, oh, this investment banker, he's just a wonderful person. And I said, there's no such thing. Nobody goes into investment banking because they want to treat bushes or they want to help children. You only go into investment banking if you want to make money. That's the only thing that comes out of it. My point being is that if you believe that your life has to have a purpose and you become a true believer, then yeah, you're going to take losses. I mean, understand something. If losing money was something that made me sick, I would have been gone a long time ago. But the reality is, I believe we're on a crusade, and I believe we have something, and I put it all on the line. I mean, I lost so much money. I think in 2011, my net worth was on the wrong side of positive. But, so I'm different. You people are rational. Remember that word common sense? So if you're investing to invest, that's one thing. But when you're captain of the ship, you don't run from the battle, and you sure as heck don't abandon it. So, other questions? Yes, sir. It's like the VA system without anybody caring. No, wait till you have it for everybody, my friend, okay? Let me make a comment. I have been all over the world. And when I went to the Soviet Union, and by the way, please understand something. I'm proud to tell you I'm an idiot, okay? I mean, if it wasn't for suffering and pain, I wouldn't learn anything, okay? I'm one of those really dumb people, you know, that God's got to beat me to understand. We were in Kiev when I first went over, and one of my partners stepped on something in the hotel room and cut their foot. Pretty big gash. What do? You go down, you get a taxi, you go to the hospital, and you get stitches, right? We're on the way there, and our sponsors came to the hotel and said, where are they at? Oh, they went to the hospital. Next thing we know, here are police cars racing, sirens screaming. They pull up the hospital. Don't go in there, are you crazy? Those things are death traps. They're infected. No one cleans anything. You got to bring your own bandages. You got to bring your own medicines. I mean, people really have never seen this. They don't understand. It is not going to be pretty. And she's not joking. By the way, when I first brought Vika to the United States, and she came with me, and we went to a grocery store, like an Alpha Beta or whatever the big grocery store chain is. We walked in there, and she looks, oh, wow, you must be really politically connected to be getting a store with all this inside. We had hot water. She thought I was really powerful. Single payer means that there is no accountability. And the problem is, for those people who believe in accountability, it fails. And also, just one other thing for those people, and I've started a lot of companies, and I was hired by the Koreans to help start companies. I was hired by the Turks. I mean, I've been a lot of places. To have entrepreneurship, what's the number one thing you need? Anybody? Huh? Guts? Stupidity works, believe me. Well, number one thing you need. What? Entrepreneurship, that's the number one thing you need is necessity. Let me help you with what all the politicians never tell people. Somebody doesn't sit there and say, oh my gosh, I think I have a brilliant idea. I'm going to go out and raise $100 million from venture capitalists, and I'm going to go start a solar panel company. That is less than 5% of entrepreneurship. 95% of entrepreneurship is, I can't get a job. No one will hire me. I'm too old. I still use crank this and that. I've got to go out and start a business. It's called forced entrepreneurship. It's called forced. I can't get a job. I'm going to go make something. And that needs necessity. And necessity drives everything. And the second you take away necessity, you don't get innovation, you don't get accountability. And so, to keep it simple, you can't stay in bed, nice and warm and cozy, and build an empire. You got to choose. Any other questions before I get in trouble with my wife again? How much time do I have? Everybody's hoping that you're going to stay very short. I still have 10 minutes? You guys want to see me dance? No. Yes, sir. No. So you have you have obviously venture capital or private equity. And that's when you buy into a company hoping that someday in the future there's a liquidating event. So as an example, SoftBank has invested in that real estate project that just deferred their IPO, and SoftBank's going to lose half of its money. That's a private equity investment. Outcome unknown. Could be very good, could be very bad. IPO is when you go public and then your shares are traded so everybody can see it. Pre-IPOs come back to the fact that, and when I was an investment banker, somebody come and say, hey, I've got a great computer company, life is good. And I'd say, great. We've looked at it, we'll take you public. We'll raise $1 million, or we'll make $6 million for you, 1 million shares at $6. We'll take you public. And he goes, great. And I say, okay, now, how are you going to pay for the lawyers? They're about $400,000. How are you going to pay for the auditors? How are you going to pay for the printer? How are you going to pay for the New York Stock Exchange fee? How are you going to pay for this? How are you going to pay? Oh, I'm desperate for cash. I mean, that's why I'm going public, is to get money. Well, you need money to pay the professionals to get the money. Oh, how am I going to come up with $500,000? I can probably get somebody who will make that pre-IPO investment. And that means when you have a contract to go public, okay? And that money you invest because you have a high degree of certainty that the IPO will happen. Now, the reason I make that comment is the regulators came along, and I used to write that check. I made a lot of money that way. And it was legal at the time. Okay, that's how Hamburg and Quist made their money, Montgomery Securities, etc. It was really sweet. Unfortunately, the government came along and said that's not legal because you're getting excess compensation for taking a company public. And of course, the law says you can only charge so much when you take a company public. And they said, well, the only reason you invested is because you knew it was going public. So people are barred from that who are in the business. So in our case, we have a commitment from a securities firm to take us public at $10 a share. They're not huge, but they've done $53 billion worth of IPOs. I know them extremely well. The managing director is my son. And so what we're looking for is not the money. We got money. We're looking for a vehicle that can get attention. And so it's designed to be a race car. It's, no glove compartment, no trunk, no passenger seat, big engine, big tires, go one way. And we believe that that will get us the attention that will help us get the support. One of the things that's a reality is that we show people a list of all the diseases that we're working on. You can't be a human over 55 and not be touched by that list. Okay? What we've discovered is when people see something on that list, they get all excited. I have a friend in Stuart, Florida. He's 90 years old. I took his company public in the 70s. He sold out for $600 million, so he's doing okay. His comment to me, he goes golfing every day, by the way. That seems to be his business. And every time when he gets back to the clubhouse, he has 3 more believers in what we're doing. But he said, Dan, I was sitting there, I was telling people about what we're doing, and all of a sudden one guy says, multiple sclerosis, my daughter has multiple sclerosis. How can I help? So in answer to your question, we're trying to make new friends. Okay, I think we should break. Ladies and gentlemen, I thank you for coming. and appreciate